Hi, everyone, and welcome to Arthritis Consumer Experts #CArthritis event, which is going to be streaming now on our website, on Facebook and Twitter. It is my absolute pleasure to invite Anne MacLeod to our studio. Welcome, Anne. So nice to see you.
Thanks for having me, Cheryl.
Yeah, it's just great. I know you're right in the thick of the annual scientific meeting for the Arthritis Health Professions Association in conjunction with the Canadian Rheumatology Association. I'm just going to tell our audience a little bit about you. Anne is the Arthritis Health Professions Association president, and which means she gets all the fun jobs, all the dirty jobs, all the tough jobs.
All the jobs.
Yeah, all the jobs. She's a physiotherapist, an extended role practitioner, and also an assistant professor at the Northern Ontario School of Medicine. So we couldn't be more honored to have you in the studio with us, Anne. We're going to talk to you really quickly before you scoot back to the meeting about the pre-course that you just held. So in other words, you hold a pre-course or a pre-scientific meeting event for your membership that spans 2 days. And I guess now that you've just come out of that and rolled right into your annual scientific meeting, give us a couple of sort of takeaways or pearls from that meeting. What were your general impressions as someone who obviously led the organization of it, but also got to participate in it throughout the 2 days?
So this was our 14th annual pre-course. I think, again, we managed to have so many great speakers and lots of, great practical things, but then also stuff that challenged us to think differently. On our first day, we were joined by Ed Keystone, who, again, delivers such engaging and compassionate kind of insights. We had Dr. Bindi Kiria, who spoke about comorbidities in RA. And again, that challenge for all of us to work together to figure out how we ensure that people living with arthritis are having the comorbidities assessed and managed and treated appropriately, right? And how
because it's not just my arthritis. It's all those things that circle around us, which are comorbidities. Yeah,
exactly. And we talk about it be a whole systems, diseases. And so how does that affect us on many different levels? And how can we do this better? In rheumatology, when we sometimes feel overwhelmed by all the pieces that we have to tackle, how can we better pull together all the team players, right? And so I think there was a good discussion starting there. It was also very interesting to learn about the arthritis rehab program in Montreal. And their work and looking at ecosystems of clients, right, and all the different components. And then, that question of if somebody's asking for disability form, how do we go about doing this? How do we best make sure that we're meeting the needs of the person living with arthritis?
Yeah.
On day 2, we had Dr. Halai, who gave a really informative update on foot and ankle surgery.
I love that talk because I have a very bad ankle, so I learned a ton from him.
Yes, and I just so much to learn. I think I came away with a list of questions to check back in with my local foot and ankle surgeon about, okay, how are we missing things? How can we do this differently, right? And how can we work together as teams?
Yeah.
I apologize. My brain just drew a blank.
No, that's okay. You had so much
lupus update.
Yeah, the lupus update was excellent.
Exactly, and about new medications and frames, and then finally our last panel discussion on equity and inclusion. And I was really pleased that you joined us for that, and that we also had Dr. Lakai and a second-year physiotherapy student who talked about her work on looking at equity lens for research, and then also a real call to action from her in terms of getting involved in your community and how, as a physiotherapy student or an allied health profession student, might look at things a little differently with that equity lens. And so I think there were some great challenges to all of us as healthcare providers, researchers, administrators. How do we challenge ourselves? How do we learn more? And how do we move forward, to make sure that we're all looking at it with an equity?
Yeah, central to that whole theme, and as you know, is this is implicit bias. It's how were we raised? What things did we hear in our ears all the time that we now know are wrong? that are racist or biased or prejudicial towards another human being. And as you know, I'm coming to you from the land of the Coast Salish people today, their traditional, ancestral, and unceded territory, and the work around truth and reconciliation, I know is so important to your association as well as to our organization. And I was so pleased to see that this year's theme of the annual scientific meeting was about inclusion, was about diversity, and the arthritis community really putting its arms around this and saying, okay, we need to stand up and be counted in this effort to eliminate racism in healthcare. And I'm so proud of your organization. I'm so happy, obviously, and it aligns very nicely, obviously, with the work we're doing. So when you think about what you've just learned in your own pre-course and what you're seeing so far, day 2, early in the day, but still day 2 of your annual scientific meeting, what has stood out for you so far, and what are you looking forward to in terms of the presentations upcoming over the next 2 days?
So, I think yesterday's opening events last evening, and Dr. Grace Wright, her conversation and looking a lot of that research data, but then also putting it into perspectives of, at all different levels, and from in terms of patient experiences to healthcare provider experiences to how do we really make that room, like that play on words, more inclusive, right? And really having everybody participating. So I think, unfortunately, today I haven't had a chance to watch anything. I've been on in the background.
Dr. Grace Wright has been on, and you can watch those on demand.
Yes.
You can play catch up.
That's on exactly my list of things to do. So I think this opportunity where we're trying to reflect in all our different talks and pieces about equity and inclusion, just bringing that to the forefront makes us think about those different pieces. So I actually just moderated an AHPA workshop on virtual care, and the idea of if we're using virtual care and how can it be inclusive and equitable. And there are great efforts because we can reach more people, right? But for some people, they don't have the technology, landlines may not work, or virtual, may not have access to cameras, or, so how do we make this equitable for everybody and inclusive? So I think there's lots of great pieces coming up over the conference in the next couple of weeks.
I think you're familiar with the survey that we conducted early last year and reported out on. We presented the data at the American College of Rheumatology meeting, and people from the BIPOC community, so Indigenous, Black, LGBTQ, they were 3 times more likely to encounter a difficulty getting virtual care or with the virtual care delivery once they got access to it than a non-Indigenous Black, someone from the BIPOC community. I mean, that's staggering. And what that tells me as a layperson, as a patient or consumer educator, Anne, is that the gaps, so the inequity in care that you're getting in person has just been flopped over to the virtual care setting without that deeper consideration, that deeper, address of those gaps. And not all of them can be solved by health policy decision makers. They include the folks who work across the hall that are supposed to ensure broadband access in rural, remote communities, right? So it's not just in healthcare that we're having to address these things. It's across the spectrum of government. When you think, I guess, about the last year and you think about your own, let's bring this right to the ground where patients like me live in terms of, for example, your huge area of expertise, physiotherapy. What do you see as some of the things that have been, advances? Like what do you perceive to have been, not just from your own perspective, but from what you're hearing from patients? What's sort of been the breakout takeaways for you over the last year in your profession?
They're breakout things, but sort of sad things at the same time, right? So recognizing, the effects of pandemic on all of us, and really, I think across all the disciplines, all the allied health professions and rheumatologists, much more discussion about people's mental health, right? And and also about movement. And so, how do we, so although, as a physiotherapist, it's not within my scope to counsel people in their mental health, but it's certainly within my scope to talk about, what are things that we do that takes care of us across all these different pieces, and things that we never used to consider exercise, like just getting in your car to go run your errands, right? Or popping over to a friend's, all those things that people stopped doing. We're actually moving our bodies. So how do we find ways to just move in our daily lives, right? And so the exercise snacks is a great little thing.
Yeah.
Also simple things. So I think this has been, it's brought the conversation to a different level, right? Rather than just exercise or, strict mental health, how these things interweave together, and the benefits of being able to get outside and breathe some fresh air, and if you're lucky enough to have access to forest and trees and rivers and to immerse yourself in that, all these different benefits. So I think that's really been, I would say, that I see across with everyone, is that how important movement is, and our mental health as well, and different ways that we need to take care of ourselves.
I agree with you. You're brilliant, and you're so sharp in terms of, and on point of what you're observing, as well as what you're practicing, and what demands are coming at you. And I would say, when I go to Twitter, or I go to our community boards, or I look at our feedback at jointhealth.org channel, our emails that come in, the information about physical activity seems to me to have really gone way up for the very reasons you point out, Anne, and which tells you about need. So it seems like, not for the first time, but in large measure, we're really seeing what you're wanting to talk about, you meaning the health professional community, and the needs of the community seem very aligned right now. And this whole idea, I'm glad to hear you say this is where your lane is, but I would encourage all of you and your colleagues not to stay in your lane and to ask about someone's mental health at the moment, right? There is no lane when it comes to the emotional and psychological wellness of our fellow human beings. So just asking someone how they're doing and sitting quietly and listening for a few minutes is going to advance what you're really hoping to accomplish with them physically. Do you know what I mean?
Absolutely.
If you can't talk about the inside, it's really hard to work on the outside sometimes. So really appreciate your observations and your support in that area. I think that what I'm seeing coming across lay communication channels like Twitter or WebMD or the CRA or AHPA communications, the information's been very practical, and the more practical you can make something, the better for people like me. So I know you've got to run back to the meeting and continue providing the great education that you do as an association, not just to your peers in the AHPA, but also across the aisle to the Canadian Rheumatology Association. Because they get asked a lot of questions about the things that you're expert in. And so informing them about those pearls is so important to people's actual daily lives. So really appreciate you joining us, and you're always welcome back into the studio. We want to congratulate you and the Canadian Rheumatology Association for pulling off yet another meeting in what I call Virtual City. And we want to thank our audience for tuning in for our 8th annual #CARthritis event. So we'll see you again very shortly. Bye.
Thanks so much, Cheryl.